This is Kyle Fonts, and this is my treatment group video for dissociative disorders. My client is Hillary Drake, and she's age 24. The differential diagnosis for Hillary was depersonalization/derealization disorder. This was the only one that really fits, so this is the one we went with. The primary diagnostic features for depersonalization disorder are disruption in consciousness that results in a sense of detachment from one's body, and often involves bodily sensations that heighten the sense of detachment. So for Hillary's story, she's a 24-year-old college student who came in to get psychological intervention because she was worried she might be losing it. For the past year, she's experienced frequent episodes of not feeling herself. She describes them. She begins with the sense that she's no longer in her body. She feels like she's standing behind her body. It gives her a sense of panic. She doesn't have any control over her body, and she has balance difficulties while she's having these episodes. And because of her balance problems, she often misjudges depths and hits walls and other people or furniture. When asked if there's more likely times to have the episodes, she says it's when she's around others and expected them to perform in some way. So social situations are rough for her. When an episode occurs, Hillary tries to fight it off by stomping her feet and thinking repeatedly that it will end soon. It used to work when the episodes first started, and now it's starting to work less and less. The frequency of the episodes has increased over the past few months. Sometimes it happens 4 to 5 times a week now. She's now seeking psychological evaluation because the things are beginning to affect her social life. She's declining social invitations a lot because they usually lead to an attack, and so now her friends have just started to stop asking her to come out. In addition to the academic stressors she has, Hillary reports that a few months ago her parents informed her they were getting a divorce after 28 years of marriage. This had come as a big shock to her because they barely ever fought, and she never thought that the family would break up. So this disruption in her life has also led to some problems. And that is it for Hillary's story. The multi-axial diagnosis for Hillary is Axis 1 depersonalization/derealization disorder. Axis 2 is none, Axis 3 is none, and Axis 4 is parents recently divorced and socially isolated. And then Axis 5, the GAF, is 70. For the theoretical perspectives, there's 2, the biological and the psychodynamic. Oh, there's 3, and the behavioral as well. Biological perspective, the abnormalities in the brain areas could be the cause of these episodes, including the prefrontal cortex, visual, auditory, and somato-sensory cortexes. These are all part of the brain that creates the body image. So when something goes wrong in these areas, usually leads to detached episodes, and also a dysregulation of the sympathetic nervous system. The fight or flight mechanism could result in abnormal cortisol levels. This is a stress hormone, and this is why these episodes tend to occur for Hillary when she's stressed. Moving on to the psychodynamic perspective, she's undergoing repression. She represses the feelings about the stressors that she has, and then she uses dissociation from herself as a defense mechanism from the various stressors. And then the behavioral perspective, she's going through operant conditioning. She's negatively reinforced when she has an episode because it gives her the ability to escape her many stressors. And that is it for Hillary.